can you just contrast the revenue generation that's occurred as a result of Facebook versus your initial approach, which was targeting physicians?
Oh, sure. It's I would say that we derive still 70% of our business through this channel of using social media to draw on consumers, and then from that, and I don't want to give the impression that the consumer business is a highly profitable area, but it allows us then to approach the physician and secure that as a provider. And so we've built our base from 100 physicians to now nearly 1,300 physicians that participate and send samples in.
So Greg, you have a very structured approach to working with people who inquire. Can you walk us through the touch points that you have with your consumers?
Absolutely. We've learned over the last couple of years that the consumer is concerned. There's a certain population out there that is concerned about the risk for lung cancer, former smoker, current smoker, and as they became more educated about it via our site or other mechanisms, we realized that they could provide the catalyst for our test. And so in working with these consumers, we realized that in a lot of cases they were very proactive with their physicians and could in essence bring this technology to the physician. So we've worked with, as I will call them, consumers, because they're not yet patients. We would work with these consumers to educate them about the test, to validate their risk. And I mean, we would want to make sure they are at high risk for lung cancer, given age, given smoking history, environmental factors, family history. And if so, we would then validate they have a physician, they have an upcoming appointment, and then we provide materials to them that, if they were so inclined, they could take to the physician, share that information with them. We tended to also try to reach the physicians because we didn't want the physician to be caught flat-footed, off guard about our tests, and a lot of them may not know about this new technology, but really collaborate with both that consumer and the physician to receive adoption of the test with that one particular consumer patient. At that point, we have a physician liaison group that then contacts the physician, because this is a physician ordered test and a physician reported test. So once that consumer patient provides information to the physician, we are then talking to the physician at that point, providing them the results of the test, and then we follow up the physician. And then at that point, we're looking to secure that physician as a provider beyond that single patient experience. And that has worked for us, both in bringing the consumer to the physician for a one-time event, and in securing the physician over time to provide the test to other patients. To date, we have nearly 1,300 physicians that are participating in sending in samples at this point. So it's a fairly significant number.
So you're not cutting out the physician. This is not a home-based test.
It is not. No, the test is, we operate as a laboratory service. So this is a lab-developed test. The sample comes to us from the physician's office or from a draw station where the physician sent that patient. We then perform the test and we report it back to the physician. So it is ultimately the physician's decision that that patient should acquire the test based on their risk factors and their age and other factors that they dial into it, and then we report those results back.
Right.
With those results that are positive, we then follow up with the physician with our clinical support team to make sure they fully understand what the results mean to them.
So the key there is that if someone comes back with a positive test, they're not out there on their own without a support system.
Absolutely not. It is part of the test report that we send back, and in addition, we have a clinical team that makes every attempt to reach the physician live to have a conversation. And not just with a single positive result, but any and all positive results they may get thereafter until they feel comfortable with the outcomes.
So Greg, is Facebook the be-all and end-all of using social media as a channel?
Well, I look at Facebook in two parts. there's the advertising side of Facebook, which we utilize and has generated very steady number of visitors to our sites and resulting leads, as we call it, and that's been very steady. And then there's the Facebook as a social network, which we also use, and we have a very strong following on our Facebook page. I mean, it allows a lot of interaction with both survivors, I shouldn't say both, survivors, loved ones, and those that feel that they're at risk. And so we have a lot of communications on a daily basis with that community. And we've done such things as, in fact, we saw a need with this group to actually build what we call an awareness wall, where we saw a lot of people come to us that had lost someone, or they were a survivor and wanted to share their hope and their aspirations from surviving this disease. And so we created an awareness wall. We've actually just hit 1,000 placements on our awareness wall in our first year, and that allows people to post images and commentary, be it a loved one that lost someone, or it could be a survivor, and that's been a good success for us at that point. But, you know, Facebook is probably the most, to get back to your original question, Facebook is probably the most predominant social media tool we use, but it's not the only one. We're very active in Twitter. We have several thousand followers on our Twitter, and that allows us to feed information on a fairly significant basis. We have a YouTube channel, which has a good following. We have Read It, Stumble Upon. So we're using a lot of the tools that are available out there and looking for new ones that can broaden our audience.
And you're here in DC talking to some advocacy groups. Can you share with us a little bit of what that initiative is all about?
Yes. You know, when in the healthcare channel, there's a lot of touch points, and one of those touch points is advocacy. And so we've tried to build relationships, bridges with the advocacy groups in lung cancer. There's a few that are nationwide, and there's even more that are on a regional or local basis. And so I happen to be in DC to participate in one of the advocacy meetings and get an opportunity to meet some of the advocates, which in a lot of cases are providers, such as nurse navigators, survivors, and loved ones of those that perish from the disease.
And what do you anticipate can be the positive impact of advocacy groups, particularly in the area of lung cancer prevention and treatment?
I think the biggest thing in lung cancer is awareness. And you know, that awareness falls probably in three areas. First off, those at risk. We need to make people aware that they're at risk and that there are options. There are choices they can make, such as smoking cessation, such as early detection, such as a variety of different treatments if lung cancer is detected. Then there's the clinicians to make them more aware of the same things, the ability for early detection and different treatment options. And then I think it's really one at that point of the government, because lung cancer is not very well funded. There's not a lot of research being done, and so there's actually a bill in process now that a lot of the advocacy groups are moving along to see if there can be more awareness about lung cancer and more funding dedicated to it.